Thank you.
The reason why we wanted to
Back
wait
Congressman
is
Stupak.
important because the agreement we've been able to reach, standing on our principle of protecting the sanctity of life in healthcare reform, could not have been done without the support of the colleagues with me today and our West Virginia colleagues, Mr. Rahal, Mr. Mollahan. So I'm pleased to announce that we have an agreement, and it's with the help of the President, the Speaker, we were able to come with an agreement to protect the sanctity of life in the healthcare reform, that there will be no public funding for abortion in this legislation. We've all stood on principle. It's a principle we've carried forward ever since June 25th when we first signed a letter to the Speaker saying, as we do healthcare reform, we do not want any public funding for abortion. We expect the current Hyde language to apply throughout this healthcare bill. We've always said, most of us at least, that we were for healthcare reform. We wanted to see healthcare reform, but there was a principle that meant more to us than anything, and that was the sanctity of life, that you have to continue with that moral principle of protecting those unborn children. So I've always supported healthcare reform. We demanded the current law be there, that the sacred promise be kept, and I'm pleased to say we have. Today, the President has announced he will be signing an executive order. That executive order will be signed after the healthcare legislation, as it refers back to the healthcare legislation, to reinforce that principle, that belief that we all stood on, no public funding for abortion. There's been some question raised by different groups that in this healthcare reform package, that somehow, some way, the abortions could be performed at the community health centers. The President's executive order makes it very clear that will not happen. There's some question that underneath in this bill that somehow you could pay for abortions with the new funds being appropriated for the community health centers. That is not possible with this executive order. There was concerns in this legislation that the conscience clause, that those who might have religious or moral objections, or a facility run by, say, the Catholic Health Association, would somehow be co-opted or their values be lessened underneath this healthcare legislation. The President makes it very clear the conscience clause will always be available and it will be a force of law. But all of that, the real victory here, or the real winner, is really the American people. 31 more million Americans will have health insurance. We will no longer be able to rescind insurance policies on the whim of the insurance companies. We have pre-existing injuries will no longer disqualify you for coverage. Your college kids, your kids in college will be able to stay on your policy longer. There will be no lifetime caps. There will be no need for Americans to go into bankruptcy because of health care. All the accomplishments we have in this health care bill and in this executive order, an extensive executive order, could not have happened without the help of my colleagues. I'd also like to thank Mr. Waxman, Mr. Dingell, the Speaker, Leader Hoyer, most importantly the President, my DC staff and my Michigan staff who have really taken a pounding these last few weeks with telephone calls. And on a personal privilege, I'd like to thank my family and friends who have stood with me, especially my wife, Lori, who has really been helping us out with her love and support. And she was the one who was accepting, or not accepting, but receiving those calls at 2 or 3 in the morning at my house while I'm out here in D.C. So hopefully that will all end. We can get back to some normal lifestyle in our family. But I want to thank my colleagues. It would not have happened without these folks right here. And they stood strong. They stood on a principle and a belief, and I'm so proud to be with them. So let me next turn to Marcy Kaptur for a few words, and who have others, then we'll take a few questions. Marcy.
It's really a great privilege to join with all of my colleagues today and to thank Congressman Bart Stupak for being a great captain of our team and reaching an agreement of significance to every family in our country. The health bill that will move forward today is actually a bill about life for all of America's families, including women and children. And no longer will any woman have to wonder whether she can bring a child to term because she can't afford it. The provisions in this bill that have to do with maternal health care, with child health care, with preventive care. The adoption credits that were included in the bill take us to a new day in America. And it is just so profound to be a part of a moment when we truly move America into the 21st century. In those communities that have provided maternal care and health care for children, for all children, we find that the abortion rate goes down significantly. Wouldn't it be wonderful if in our country no woman ever had to face the fateful decision of abortion? I think that what we have done through this bill and through this executive order is to establish a platform under all of America's families to give them the peace and security of a future where they don't
All right,
have
we're
to
going to
make
closely monitor this.
recent
Suffice it to
choices.
say
And
that Bart Stupak is now